We've been married for 32 years.
32 years,
And
yeah.
I lived in Winslow all my life. Well, off the reservation too, and been born and raised here in Winslow.
My name is Manuel Ono.
My name is Lola Ono.
Yeah, I was born in Winslow, raised in Winslow. Been here 70 years now. Going on 71. You know, so. Well, the reason I got sick is I was diabetic, and I ended up in the hospital. You know, I got fluid in my lungs. You know, and I ended up with congestive heart failure. So I was in the hospital in Flagstaff for 8 days.
We found that we just couldn't discharge a patient, send them home with a stack of papers and say, good luck in managing this very complex disease. What it is a remote patient monitoring program where we can have the opportunity to engage with our patients with chronic diseases, is where we started, so that we could put devices in their home to keep them connected to the care delivery that they needed so that they wouldn't be readmitted to the hospital.
Since I started using this, I haven't been back into the hospital for heart failure at all.
It's good to hear you. I got your message this morning.
My name is Shannon Wells, and I've been working at Flagstaff Medical Center for 18 years, for the past 3.5 years in telemedicine. As a cardiac nurse and working on the floor, as we say, I always wondered what happened to people when they would get discharged home.
The program is a series of putting technology in place along with processes in place. So some of the technology that we use, it's rooted in using the Qualcomm 2Net hub, which is a medical grade device for transmitting the data that comes from the patient's devices, such as the pulse oximeter to measure their oxygen levels, a blood pressure cuff, which also measures blood pressure, we get heart rate, and a scale. It then goes into a series of data points for our care managers to watch on a daily basis. Then by the care managers being able to watch this information coming across, they know if their patient's getting into trouble before the patient even knows they're into trouble.
Now that I've got used to it, I mean, it seems like nothing. I mean, I enjoy doing it now. And like I said, it's good for me because I know you guys are keeping track of me. And I know Shannon, as soon as something happens, my weight or whatever, boom, she's like that, she's calling me.
I get to check up on them, sometimes on a couple of times a day basis, and be able to assist them staying home, which is where they really want to be. I have to say, it's an honor to be able to do this work. Yeah.